Thank you very much, Dr. Walensky. I'd like to make a few comments over the next couple of minutes that extend what you just heard from Dr. Walensky, and that is the importance of vaccination to prevent severe disease and why we cannot pull back on our mitigation efforts. This is a paper from the Annals of Internal Medicine from some time ago, which showed that about 1/3 of people with SARS-CoV-2 infection never develop symptoms. That's the good news. Next slide. Of those who do develop symptoms, about 80% have mild to moderate symptoms, but about 20% or more have severe disease, with case fatality rates varying from a few percent to up to 20% for those requiring mechanical ventilation. Now, let me show you something that is very dramatic. If you look at the multi-system manifestations of COVID-19, they are multitudinous. The most important and common of which is the acute respiratory distress syndrome. But we know now there are neurological disorders, cardiac dysfunction, acute kidney injury, hypercoagulability. Bottom line, this is a very serious disease, which has already led to the death of about 550,000 people in the United States. Next slide. This slide is very dramatic. If you look on the left-hand part of the slide, it's a normal CT scan of the lung. The area that looks black and dark are normal lung because there are air spaces. On the right-hand side of the slide is a patient that I made rounds on at the NIH Clinical Center last week. If you look at this, even a non-physician, non-radiologist can determine that there's something very, very wrong with the lungs on the right-hand side, with the white blotches being infiltration of the lung, that even with the patient being under the top medical care that we're giving them at our hospital, still may very likely have residual scarring of the lung after improvement. Next slide. This is another patient we saw at the clinical center who developed a brain infarct as shown on the left-hand part of the slide with the arrow pointing to the infarcted part of the brain. Bottom line, as Dr. Walensky said in her experience at Mass General, the same at the NIH Clinical Center, this is a very, very bad disease. The fundamentals to prevent acquiring this are the public health measures that Dr. Walensky mentioned, but also vaccination. Absolutely critical. Next slide. If you look at the prevention of hospitalization and death among the 5 vaccines on the left-hand part of the slide, with one exception of a hospitalized patient in the vaccine arm of the Moderna study, virtually 100% protection against hospitalizations and death. In other words, we can prevent what I showed you on the previous 2 slides by getting vaccinated. And on the last slide, what you see in red is hospitalizations going down, as in the blue bars, vaccinating people going up. The bottom line, hang in there, as Dr. Walensky said. We really need to hold on to the public health measures as we get more and more people, from 2 to 3+ million people, vaccinated every day. It will be a race between the vaccine and what's going on with the dynamics of the outbreak, and we can win this by just hanging in there a bit longer. Back to you, Andy.
Thank you, Dr. Fauci and Dr. Walensky. Let's go to questions.
First question will go to Ed O'Keefe at CBS.
Thank you guys for doing this again, as always. I have one other question, but given what the director just said, I guess I want to follow up a little bit and ask, if I heard you correctly, you said you're concerned about impending doom. What is it that you saw in the data that is causing you to sort of start to feel this way again? And then was curious if you guys can discuss what is the government or the administration's current role in issuing these so-called passports or certificates, and why is it taking a little while longer for the U.S. to do that when places like Japan and China and the EU are further along?
So, Dr. Walensky, why don't you take the first question and I'll endeavor to take the second.
When we were stagnating at around 40 to 50,000 cases a day for a couple of weeks there, we didn't see trends going down anymore, but things were sort of holding steady. What we've seen over the last week or so is a steady rise of cases. We're now in the 60 to 70,000 range, and when we see that uptick in cases, what we've seen before is that things really have a tendency to surge, and surge big. We know that cases sometimes can be a week or two behind the behaviors that lead to those cases, the mixing that leads to those cases. We know that travel is up, and I just worry that we will see the surges that we saw over the summer and over the winter again.
Thank you. And I'll take your second question. Begin with this. We recognize this is a tricky and important subject, but the core here is that Americans, like people around the world who are vaccinated, will want to be able to demonstrate that vaccination in various forms. This is going to hit all parts of society, and so naturally the government is involved. But unlike other parts of the world, the government here is not viewing its role as the place to create a passport, nor a place to hold the data of citizens. We view this as something that the private sector is doing and will do. What's important to us, and we're leading an interagency process right now to go through these details, are that some important criteria be met with these credentials. Number one, that there is equitable access. That means whether or not people have access to technology or whether they don't. It's also important that we recognize that there are still many, many millions and millions of Americans that have not yet been vaccinated. So that's a fundamental equity issue. Privacy of the information, security of the information, and a marketplace of solutions are all things that are part of what we believe in, as is the ability for people to access this free and in multiple languages. So I think you will see more from us as we complete our interagency process, but this is not slowing down the process in any way. Even though the government has its own needs, so does the private sector, and the private sector and other groups working together are marching in that direction. It is important for us, and we'll be very clear about how that will happen, that the guidelines that I just talked about are part of that process.